All right. Well, good morning, everyone. It is 9:04 on October 11th. Thank you very much for your patience as we are trying a new system this morning. So, as all new things happen, where there's going to be some bumps in the road. So, I appreciate everyone's patience as we get rolling this morning on our Monday morning conference call. Um, just as a reminder, on these calls, we are recording them. I know some of you are starting to get busy for AEP, and I don't want this call to get in the way of your business, of your clients, and getting the service that they need. So I know we've already had a few agents that this morning had let me know, hey, I'm at an event or walking into a client's house, and I get it. So just know that I am recording these for your convenience. And you can go on to joinhpm.com, which I'm sharing my screen right now. And you'll just scroll all the way to the bottom. And on the right, bottom right, we have video updates there. And that'll always have the latest video call in this session available on the website there. I also send you guys out an email and a text message just as a reminder as well later in the week of the call that you might have missed. So just know that that is on YouTube and on our main website at joinhpm.com. So just know that you're not missing out. All you got to do is just jump back into there and you should be good to go. Okay. So new system, we're testing everything out and I hope everything works today. Just a couple of glitches here this morning. And I know people are still probably joining the other call and they're going to be trickling in as we get used to the new system. So appreciate it. Also, just as a reminder, you do have this call in video. So if you're joining us by phone, then you may be missing out on some visuals as well. So if and when possible, join the call via the web link that I email in text message. Okay, there's a little video link there in the email, and then just save that and jump on the call in case you're on your phone instead. So that way you can see what's going on with the share screen and all that good stuff, because we are going to be sharing some good stuff as we move forward. Okay, as we always begin, our mission, should you choose to accept it, is to improve the lives of our community with affordable healthcare. Thank you very much for being a part of that mission. And thank you very much for serving your clients and our community, helping them with their healthcare needs. We've got some really great updates so far that I'm going to share with you. The star ratings are starting to trickle in, so this is really, really exciting. And the official beginning of AEP is this week on October 15th. So another season begins. So we're going to talk a little bit about pre-AEP and what you should be doing just to ensure that everybody's on the right page. Okay. Here we go. So first things first, let's talk about training. As always, we do have training sessions available throughout the week. Thank you, Tom, for putting everything together for us. So we've got a couple of local events happening, and then, of course, webinars happening as well. So this morning at 10 a.m., Cigna is doing a grab and go kit session at Dr. Law's office over on East Orlando. So if you are interested in meeting a doctor and picking up some kits for Cigna, that's at 10 o'clock this morning. By the way, we are inundated with kits. I went to the office over the weekend and was very surprised at how many boxes we have. It's very, very stuffy in there. So please don't hesitate to come by our office and grab all the kits that you might need getting ready for 2021. But also stock up on what you might need for 2022. Or I'm sorry, for 2021, stock up on what you have. We will not be ordering any more materials for 2021. So if you do run out of materials on 21 and they're not in our office, you're going to have to order those. But we are going to have more and more materials coming in for 2022. So those have started to trickle in at our office. And those of you that are out of market will be coordinating shipping for you. Many of you have already ordered your kits, so be patient. I know that we've got quite a bit of market materials coming through the mail, so just know that. But there are going to be these grab and go sessions, these coffee and chat sessions where you can pick up kits and get what you need to to keep your day moving. So that's Cigna today at 10. At 11, Devoted's doing their broker coffee and chat session. So you can jump on that call. That one's geared for Orlando, but any and all Devoted questions are welcome. They are going to have a fantastic year with the news that I heard today. Moving down to 4 o'clock later today, Cigna's doing their AEP training session. So if you are new to Cigna or you need a refresher on Cigna or need to know what's going on with them for AEP, check them out. They are also going to be very important, especially for Florida market. Tomorrow, the 12th. So just also keep in mind, guys, every day, Tom has loaded up at 8 o'clock in the morning on the training calendar the link to our HPM Shop 2022 video presentation. So our new quote and enroll tool is out. It's here. John is doing an amazing job getting everyone loaded in there. It's quite a bit of work. So I appreciate everyone's patience as we get through that. However, you do need to know how to use it. So the training's out. You can go ahead and jump in that training. It's on YouTube, and I cut it up into chapters. So if you just need to learn how to use the prescription side or provider search side or whatever the case might be, you can just jump over to those chapters and learn about what's going on, specifically in that particular training. But the entire HPM Shop 2022 training link is loaded in the training calendar, and it's there every day at 8 a.m. So self-service, come on in and just play the video. You can save the video on your desktop, whatever. It's a good reference point. They did a great job building that out for us. Okay, tomorrow at 1 o'clock, the MAPD member journey is set up at 1 o'clock. That's looks like that's going to be through our system with HPM Shop. The company that helped us build it was Connecture. So they're going to talk about the member journey, the challenges, the solutions, and the impact on health plans and members. This is good. I mean, this is kind of out of the box training and talking about using the software and what that means for your members and how that, is going to help them when they're doing their shopping. It's also going to talk about engagement and retention practices, which is really, really important. And then what impacts a health plan or an agency's ability to improve their own customer experience. And that relates directly back to you. So the member journey, that's tomorrow at 1 o'clock. That's hosted by Connecture. Also tomorrow, Oscar is starting to host their open enrollment webinars. This is for those folks that are doing individual and family plans, both on and off exchange. Oscar has some really amazing plans for next year. So come learn about those. The first session is tomorrow at 3:30. You can jump on that webinar. Jumping over to October 13th, that's this Wednesday, Ambetter's also doing their rollout sessions for open enrollment for 2022. That's at 9 o'clock on Wednesday. You can go ahead and jump over to our training calendar and register there. Humana is doing a Vantage training at 10 o'clock. Again, we really don't need to focus too much on their enrollment side, but Vantage is their full portal system, and they've got some really cool things in there that I like seeing. You can now check your book of business, and most importantly, with Humana now, you can check the status of your application without having to call them. It should show up right on your portal system. So I really like that. You can learn more about that service on Wednesday at 10 o'clock. Also on Wednesday, Oscar's doing a new session at 10:30 for their open enrollment training session for 2022, and another of that same session on Wednesday at 1:30. So again, Oscar training's coming out tomorrow 3:30, Wednesday 10:30, Wednesday 1:30. So if you're in the individual and family plan space, you don't want to miss those. Okay, moving on to Thursday. Tom has set aside time every week at 9 o'clock on Thursdays for any question and answer sessions that you might have, okay? You can call into us, and Tom will be waiting with all the right answers for you. Well, you might not have all of them, but he'll know where to look and search and help you. So you can call into HPM. You can ask whatever questions you have, including our new HPM Shop, whether it's AEP questions, Medicaid questions, whatever it is, we're here to help you. 9 o'clock, open mic session. Come on in, anything that you might need. Even if you feel like it's a little personal or whatever, just come on in. We're here to help you as best we can. That's going to be on the Google call. That's at 9 o'clock every Thursday throughout AEP. So kind of like a standing question and answer there to help you out. Also on Thursday, again, this is another market specific in Leesburg area. So the Central North Orlando area. If you're wanting Cigna kits, you can do a grab and go session over with Aegis, Dr. Pellegrino's office in Leesburg. Again, you're going to want to know about Cigna. I'm going to talk about that in just a moment. Devoted is doing a coffee and chat session again on Thursday at 11:30. So that one's geared for Jacksonville, but anyone is welcome. Also on Thursday at 2 o'clock, we've got working with providers. So we've got that training session. If you are interested in continuing to learn about how to work with providers, that is at 2 o'clock on Thursday. And we'll be doing the training session. I believe that's with Nick and Tom, if I'm not mistaken there. And then Thursday at 3 o'clock, WellCare is doing their virtual rollout session with Allwell as well. So this is the first AEP they're going in together. So WellCare Allwell is doing their virtual rollout session for 2022. That's at 3 o'clock on Thursday. So again, if you need to know some specifics about those particular products, great session on Thursday at 3. And so that's the training for the week, guys. As always, keep one foot in the classroom and the other one in the field at all times. Really important to ensure that you know what you're doing so your clients can be helped properly, okay? Also, as a reminder, that HPM Shop training session is on the training calendar every day at 8 o'clock. So if you're looking for that, just click that and you're good to go. Okay, moving on over to Pre-AEP. So we're still at the back end of Pre-AEP and want to talk to you guys about a couple of situations we've run into. Now, some folks are in their ICEP or IEP. They're turning 65 and they're going to be 65. They got their Medicare card in the mail already because it's 3 months before, and it's for a January 1st effective. So can you write that person now for a January 1st effective in 2022? Now they're aging in, so they're exempt from AEP, right? Because they're in their ICEP and their IEP. But can we write them up on a 2022 plan today? The answer is no, you cannot. Because no matter what, you cannot discuss 2022 benefits until October 15th. So we just have a few more days, okay? You can discuss it, but you can't enroll them, okay? So if they call you and say, hey, Justin, I just got my Medicare card. It's for 1/1 effective. Can you help me out? The answer is we could definitely talk about the plans now because we're in pre-AEP, October 1 through October 14. And so let's get together. You can do a scope of appointment. You can build out their profile on HPM Shop, collect their medications, collect their doctors. You can even set up some quotes. You can even email them over some quotes. You can help them pick out the plan, but they will not be able to enroll through HPM Shop until October 15th, which is this week, okay? So you can get them rolling. If for whatever reason, you have to leave a kit behind, just make sure that they're not mailing in the application, okay? Because that'll ding you real good if the health plan gets it before October 15th. So just make sure that you're protecting yourself there. But if you're using HPM Shop, you shouldn't run into that problem, right? So you can send them over the quote, and even if they tried to enroll themselves, there'll be an enrollment button there. It'll say come back on October 15th to get started. So you can definitely get that going. In fact, that's best practice right now. If you're not building out profiles using Pre-AEP when you're talking to your clients, you're kind of missing out here. You can have, on October 15, you could turn in 20, 30 applications if you've built out their profiles and talked to your clients and get them in your system loaded. And remember, all that information that you're capturing from your client and you're saving in HPM Shop, it will automatically transfer over to the application. So that's going to save you a ton of time with data input, right? And so all the quotes, all the meds, all the doctors, that's saved in there forever and ever. You don't have to recollect all that information. It's there for you. So use HPM Shop to your advantage. This is a really, really key piece of software, and especially getting ready for pre-AEP. You could really do some serious damage here if you're using HPM Shop to get that going. Okay. All right, let's switch over real quick to star ratings. Now, I don't have everyone's star ratings. They're starting to trickle in as we're getting official notices from the health plans. But I have some really great news as far as star ratings are concerned. Specifically, I'm going to start with Florida because, this is where I'm getting most of the information at this moment right now. So the first one that I heard of was Cigna. Congratulations to Cigna. They have achieved 5 stars again for 2022. So that means for you get to write Cigna year round for 2022. Okay. So again, now you see why it's so important to know about that Cigna product for this year, because now you have a 5-star plan in your pocket if you're contracted with Cigna. If you're not contracted with Cigna, that's okay. Shoot us a message, call the office, we'll get you loaded. You can text me also. I'd be happy to load that in. Doesn't matter to me. Just let us know, and we'll send over the instructions to get you contracted with Cigna. 5 stars. So congratulations. That's 4 years in a row for Cigna. I think they're one of the few carriers that have ever done that for so long. 4 years in a row. Really, really impressive. Again, that's really going to help you grow your business. And also a 5-star plan for a client is really good. Okay. Next one I heard about was Devoted. Devoted has been waiting patiently for their first star rating. They came out 3 years ago. I remember the day. And ever since then, it says plan too new for a star rating. So first time out of the gate with a star rating for 2022, 4.5. 4.5. So congratulations to Devoted. That is an excellent score for being a first-time star rating. 4.5 stars is really good. That means they're so close to that 5-star rating that I'd keep an eye on Devoted. Again, no surprise there. I think they're one of the plans to beat for 22 and moving forward. So Devoted 4.5 stars this year. And then out of the blue here, this one was really caught me off surprise. This is for a Florida plan also in the Tampa market. New plan with a 5-star rating. Never seen this before. Baycare. Baycare achieved 5 stars for 2022. So Baycare is a smaller regional plan that does have the hospital systems and the doctors in network. They have achieved a 5-star rating. Again, that means that you can write that business year round. So if you're not contracted with Baycare, those of you that are in the Orlando market, I believe they stretches south as Polk County and then into the Tampa market as well. So if you're not doing business with them, we're happy to help you get a contract and get them rolling as well. So 5-star, we got 2 5-star plans so far in our backyard, Baycare and Cigna. And as we're starting to see more and more star ratings, just keep an eye on your email. If you're not in Florida, I understand you will be notified by email by all the carriers with their star ratings. And also as a reminder, now that we've got the official star ratings, the health plans are going to start printing out that addendum, that star rating sheet, and mailing it out to you. If you've ordered kits, they're going to most likely automatically mail out some star rating sheets to update your kits. So just keep that in mind. The star rating that you see in the kits, because they needed to get everything printed, they printed the 2021 star rating. So you need to start exchanging that 21 star rating with the 22 star ratings as they're starting to come out. I do know that more and more star ratings are going to start rolling out. So as I learn about these, I will announce them on the phone calls. But we're really, really excited to be representing already 2 5-star plans for 2022. Really excited to help Cigna grow and Baycare grow this year. Very excited about that. Okay, let's talk about let's talk about another situation here that seems to be happening across the way here. As we're getting into the weeds of AEP and then an OEP as well for Medicare. We have a lot of folks that are looking to retire or losing their employer coverage. And what happens to an individual that may have delayed their Medicare Part B? Because there's no reason for you to have Medicare Part B if you're getting the same services from your employer. Okay, so let's say a member comes to you and says, "Hey, I'm getting ready to retire, and I've got this Medicare, and maybe I've had it for a few years, but I didn't have my Part B." Maybe they had their Part B on already. Sometimes that happens, and they're kind of double paying for the same service, right? What do I do? How do I, I saw this plan on TV, daycare 5-star, and I'm really interested in it, and I think I might want to join it. Well, the first thing that you should talk about with your client, with your prospect, is about that employer coverage. What does that look like? Is that completely sponsored by their work? Do they have to pay? Does some of that come out of their paycheck? Is their spouse attached to it? What's going on in that employer coverage, and get a good, clear picture on what that plan looks like. Because you don't want to just say, yeah, let me cancel that and put you on an Medicare Advantage plan, because you could end up hurting that person pretty bad. Most of the time, if a retiree or someone that's continuing to work decides to decline their employer coverage or terminate their employer coverage after their employment has ended, it is nearly impossible to get it back. So they really have to check with HR to say, hey, if I cancel this coverage, am I able to get it back? And a lot of the times, most of the time, they're not able to get it back. So they have to make that definitive decision to say, oh yeah, I want to get rid of this. It's too expensive. It's not enough coverage. I want more flexibility, whatever that looks like. Please pay attention to what they currently have, because if the employer is paying 100%, if it's a union coverage and they're getting a lot of it sponsored by their employer, then you probably want to make sure that you've got, you want to leave that alone, right? So please pay attention to that. Be fair to your member. And then also, if they've got a spouse attached to it, you might have to wait or find a solution for that spouse, especially if you're doing individual and family plans, ACA, Obamacare. If you're doing those on exchange, off exchange plans, then you have a solution to move that person over and out of that employer coverage before the spouse retires and gets on a Medicare Advantage plan. Okay. Now let's talk about the person that may have delayed their Medicare Part B, and they say, I delayed my Medicare Part B, but now I want to take it, and then I want to drop my employer coverage. Can I do that at any time? Well, you can't just apply for Medicare Part B. There's a special enrollment period every year from January 1st to March 31st, and you can apply for Medicare Part B during that time. That's the general Part B enrollment period every year. And then if you decide to enroll in your Medicare Part B at that time, then it will start for you on July 1st. It'll start for you on July 1st of that year. Okay. But if your employer or you're losing employer coverage, then you can go ahead and apply for Part B. Okay. And the reason why you're applying for Part B in the middle of the year or outside of that general enrollment period is because you're losing coverage. So you can apply for Part B. Medicare will take your application, they'll review it, and they'll say, yes, you're good with that. But here's the deal. A person that is applying for Medicare Part B initially as part of their coverage will only have 60 days prior to their effective date to choose a plan. So let's say that they know they're going to lose coverage in December. They fill out their application today. Medicare approves it. They get their card in November with a December 1 effective date. They've already burnt a month, and they only have November to choose a plan using that delayed Part B enrollment period, election period. Okay. Now here's the other part you got to think about. If they're losing coverage, they'll have an additional 60 days on the backside, but those are two different SEPs. You have to pay attention to that. So the first one is, I'm new to Medicare Part B, so I have 60 days prior to my effective date to choose a plan. But if they miss it, because this is common, Some folks don't get their card until after the effective date. And then we see applications bounce because the special election period is wrong. Okay. Because they lost the SEPs over as soon as their Medicare begins. But what you have to do is select losing employer coverage or losing group coverage, and that will give you a different SEP of 60 days after that event happens. And so you can get that SEP rolling within that 60-day window. So it's important to pay attention to that when you're explaining it to your folks there. However, secret weapon, HPM Shop, okay? When you input a person's Medicare, when you put in their numbers, when you put in their effective dates, it will automatically limit the amount of SEPs that member is available for. So you can play around with those SEPs on the software, and it'll tell you whether you're good or not. Okay, so very, very important. You got that secret weapon with HPM Shop. It does all the thinking for you on that SEP, so you don't mess up the app. So I hope that helps everyone. And then there we go. So pay attention to those employer coverage. You're going to run into new and interesting situations as we move forward through AEP, and we'll continue to answer those questions. Tom just gave me an update here in the chat in case everyone has a question. You can go ahead and throw it in the chat there. Tom says that the star ratings will be reflected in HPM Shop on October 15th. So we will see the updated star ratings this week, okay? So they will be trickling in, and as they're trickling in, we'll make an announcement next Monday as well. But as Tom said, we're already, October 15th is on Friday, so that's the official day that you can take an application for 2022 and get your members rolling. So you should be able to see all the star ratings on Friday of this week loaded in the system. Okay, but as they're scrolling in, you'll see them come through your email box. Just remember to check your emails, right? Really important there, guys. Okay, so with that, I'm going to go ahead and end the call there. If you have any questions, please reach out to us. Call, text, email, shoot up a flare, walk in the office, track us down. We are good to go. We're really happy that you joined us on this call today. And as a reminder, I am going to record them. So don't feel guilty if you can't make the calls on Monday morning because you have appointments. That's a really good excuse, by the way. Seeing a client or being on the phone first thing on Monday morning, always good. So with that, I do appreciate it. I hope everyone has a fantastic week. Happy AEP. Good luck out there. And please let us know how we can help. Have a great day, guys.